Please join us for an educational home buying and Islamic financing webinar being organized for Shura Council members and subscribers. This event will be conducted by Ijaz Hussain, Senior Vice President Sales and Director of UIF Corporation. This event will take place Thursday, September 9th at 6 p.m. Pacific Time. You must register to attend this event. Thank you.
Greetings. Welcome to another program of the health program with the Shura Council here in Southern California. I welcome everybody. Hopefully you're doing well and everyone is doing well after this Labor Day holiday. Today's Tuesday, and we're wishing that you and your family had a safe and sound Labor Day weekend. We hope that everything is going great for you. Currently, as we know, school has started. Many people are going back to school, and we encourage all those that are 12 and above to get the vaccines if you can for COVID-19. The Delta variant is out and about in the community. Many people are reporting breakthrough infections, so it's important that you wear your mask outside in big crowded areas and that you practice social distancing, because people are getting COVID at a higher rate than the weeks before. So please make sure that you are practicing caution, taking cautionary measures. And if you don't have the vaccine, we encourage you to go ahead and get it, talk with your personal physician, and then go ahead and follow their advice on the vaccine. It'll be very important to do that. Right now, I think the daily death rate in the U.S. has gone up to about 1,500 deaths per day from COVID. So that's very important for you to realize and to take precaution and take precautionary measures for you and your children. Today, we're talking about hearing loss, which is something which affects many people. And just to give you an idea, hearing loss in the U.S., it affects, if you're 75 and over, it affects 50% of the population. So if you're 75 years old and older, 50% of the population in that cohort will have hearing loss, some form of hearing loss. And we'll get back to the specific forms, but it's important to realize that. If you're in the ages of 65 to 74, a quarter of you will have hearing loss. So again, 65-year-olds to 74-year-olds. So right when you retire, right when you get that Social Security check, you're in that category where a fourth, 1 out of every 4 people will have some sort of hearing loss. And we'll get to the different types momentarily. Ages 41 to 59. If you're above 40, 41 to 59, 14% of that population has hearing loss. 14. So from 41 to 59. And then if you're 29 to 40, there's a small 7% of the population. Again, from 29 to 40-year-olds, 7% of the population has hearing loss. So that's a lot of people. The prevalence, anytime that if you check in the society, there's about 40 million people across the nation that are suffering from some type of hearing loss. And fortunately or unfortunately, we find it more in men than in women. Hearing loss is more pronounced in men than in women. So I think that's something to keep in mind as well. And it's also due to the fact that women hear better at a certain frequency. They have at frequencies that are above 2,000 hertz, women have better hearing skills. So because of that, hearing loss is more prevalent in men as well. So those were the numbers. Again, it's something to keep in mind, and especially if you're taking care of seniors, because if you combine the numbers in the seniors, you have a good above 65. You have 24% up to 74, and then after 74, 50%. So you're looking at a combined ratio of about maybe 65, 70% once you're above that age. So it's something to keep in mind, and it's something where we see a lot of people suffer from. So this is something that we want to be cognizant of when dealing with people and talking to people, because hearing loss is a common occurrence. Excuse me. So there's two types of hearing loss, right? Two types categorically if we're talking about hearing loss. There's conductive loss, which is the sound does not reach the inside of your ear, and usually there's some kind of obstruction or some type of trauma that happened. That has to do with conductive loss. Conductive loss has trauma or obstruction, okay? And the sound from the outside world doesn't get into the inner ear. That's conductive loss. So then there's sensorineural, okay? Sensorineural loss, which means what? Sensory, and there's something wrong with the nerve, neural, right? There's a problem occurring either in the inner ear inside or with the nerve that is responsible, the auditory nerve, which is responsible for hearing. So there could be nerve damage, or there's some kind of damage in the inner ear. Okay, they call it sensorineural. There's sensory and neural deficits. Okay, so those are the two types. Each type has different causes and different types of remedies that we can think of for them. We tell all the young people, if you want to prevent conductive hear loss, where the damage, we don't want to damage our inner ear, we don't want to block the mechanism of the sound going from the outside to the inner ear. We tell them, noise is a very, very important thing that can cause a ruptured eardrum. So people who have continuous high sounds, nowadays we all have earpods, iPods, and we put it in our ear and we listen to it. But a lot of people, you could be sitting next to them in a bus, in a train, in a plane, and the person next to you has the earpod on, but you without the earpod can hear the music. Clearly, this is too loud. If that's happening to your young ones or even your elderly people, and they're putting these things on to listen to their music, and you're sitting next to them and you're hearing that music is too loud for their eardrums. And that could potentially cause damage in the inner ear, as well as a ruptured eardrum. Ruptured eardrums are, it'll cause, number one, hearing loss right away from conduction. So it is a conductive type of hearing loss. And number two, it also damages the interior as well, the nerve. So it's a mixed infection, mixed the cause. What we would call it, the cause of that hearing loss would be mixed. So you have conductive, sensorineural, and then you have mixed. Another cause for the mixed, which is both, would be genetically. If you have genetic disorders, some people have that, and those cause both conductive and sensorineural hearing loss. That's important to know. Infections also can cause sensory neural and as well as conductive hearing loss. And then we have head trauma. Those people that are in accidents, whether it's a motor vehicle accident, whether it's a riding a bike or a skateboard and they fall down and they hit their head. This damage usually causes conductive hearing loss as well as sensorineural. So both types. So again, genetic disorders, head trauma, and infections as well. So these three things cause both types of hearing loss, and you have to be aware of that. Let's talk a little bit more about conductive now. What are the causes of conductive hearing loss? Number one, which is very common, is fluid in the ear. You find it in young people and in middle-aged people who swim a lot. They have swimmer's ear that could lead to an infection, but also they get that fluid in the ear canal, and that causes conductive hear loss, meaning that the sound from the outside does not get into the inner ear. So it is a mechanical obstruction. The other thing are foreign objects that people put in their ears. You see a lot of young kids, they put little beads, jelly beans, all types of things that they can put inside the canal, and that causes conductive hearing loss. So if you have little ones, you have to be careful that you don't give them loose objects that they can fiddle with and put in their ear. Beads, earrings that have 2 or 3 parts, and a part can get stuck inside the ear. That's something that's very common occurrence, and then you have to go to your ER doc. And if it's deep in, the ER doc will refer you to an ENT, and they'll put a little device in to pull out the object that's stuck. The other thing is, of course, very common is impacted earwax. That also causes conductive hearing loss. So those who don't have regularly their primary care doctor kind of wash their ears and clean out the wax, that can lead to conductive hearing loss as well. And because you get impacted wax, that's just a waste of the body, and it needs to be taken out. Those are the things that cause conductive hearing loss, which again means the sound in the outside does not get into the inner ear. The ear canal itself, there's a block. It could be fluid, foreign objects, ruptured eardrum, impacted earwax. These are the things that causes conductive hearing loss. Also, another thing that causes that conductive hearing loss as well is allergies. People that have severe allergies, that kind of gets them stuffy, and you know that you have a connection between your ear and your sinuses. So that connection usually gets stuffed. So that when that happens, you get conduction loss in your hearing. That's very important to keep in mind. Looking at sensory neural hearing loss, that is something which, number one, occurs with aging. So the older we get, the more highly likely it is to get some type of inner ear malfunction, whether it's the nerve or whether it's the inner ear part. Sometimes the little bones that are inside the ear, which are called statoliths, these are inside the inner ear. They're responsible for balance as well as the reverberations of sound. So those sometimes they fuse together, and when that happens, then your sense of balance gets lost, as well as you have sensory neural hearing loss, and that's something which your ENT will decipher. And they usually, if you're a senior, on your yearly exam, they'll do a hearing exam on you, and also children at school. They usually bring someone out to check your hearing at an early age to make sure that everything has developed correctly. So that usually happens. And then the other thing, of course, is noise damage. Noise damage, more often than not, will damage the auditory nerve. And once that happens, then you have that sensory neural hearing loss, which occurs as well. Um, the other thing is, if there is a if you're near a war zone, or you live somewhere where there's blasts and explosions or fireworks that are very, very loud, those also are potential items that can damage your auditory nerve. And when that happens, you will have that sensory neural hearing loss. That's very, very obvious, and that's something which can be detected quickly if you go to your ENT. The other thing is, some people have what's known as auditory tumors, or some people call them schwannomas, where the lining of the nerve cell has an overgrowth. When that overgrowth happens, then you get that sensory neural hearing loss as well. So that's something to keep in mind. And the final thing for the sensory neural is the side effects a lot of medications we take. So you'll find that in a lot of seniors, that they're on certain medications, and these medications have a side effect of dampening the auditory nerve, or decreasing the function of hearing. And this, over time, chronically taking that medication, does damage the nerve too. So that's something to be aware of, especially if you're a senior, because a lot of the seniors here in the US, they're taking multiple drugs for different conditions, and you have uh, nobody that's really advocating for their health. Nobody's managing the medications. They've been on these medications for years, and they don't talk to their doctor about changing the medication. It's very important that you discuss your medication with your doctor every 3 to 4 months, quarterly. When you go in there, discuss your medication. Say, why am I on this? Can we decrease the dose? Can we change it to a milder medication with less side effects? This is something which you have to advocate for yourself, especially if you're a senior, because a lot of times doctors get sort of complacent, and you're on a regimen and they keep you on that regimen. And if you're not complaining and you have no issues that come up, they think everything's going wonderfully fine. But in the meantime, you could be suffering from some of the side effects. So you have to be an advocate for yourself, or a close loved one, a daughter, a son, a grandchild, someone that's aware, that can read up on these medications and then bring it to the attention of your doctor and say, hey, doc, you know, my grandma or my grandpa or my father or my mother has been on this medication for 5-6 years now. Is there any way that you know these side effects could affect them chronically? This is something that you have to discuss. And hearing loss and nerve damage to the auditory nerve, which is the nerve responsible for hearing, is a side effect of some medications that are common. So that's something where you can you know where you can keep in mind and discuss with your doctor. Again, most common causes: normal aging, you know, age relating hear loss for the sensory neural hearing loss, exposure to loud noises, and some people have industrial jobs that consistently have loud noise. And if you're at a job or at an environment where there's loud noise consistently, that'll more often than not cause hearing damage in the long run for you. So it would be wise to wear those silent uh, headphones where they can dampen the noise for you, so you get less frequency, less hertz in terms of the types of sound waves that you're getting into your inner ear. That would be very important. Um, there are some autoimmune diseases and heart diseases that they're much more less common, that do cause sensory neural hearing loss, but those are very rare. Um, a lot of people know about mumps and how they affect the hearing and all that. So, so those are there. The other thing I wanted to discuss was, um, if you or a loved one does have any inkling or any indication of hearing loss, then it would be very, very important to go and get assessed. There's nothing wrong with letting your loved one knows that, hey, my hearing loss is getting worse, or I cannot hear right now certain things that I used to be able to hear. There's no taboo. So it's important to get that assessment. Your primary care office usually has a hearing test that they'll do for you. They should be doing it yearly for you. If they're not doing it yearly, then you need to bring it up. And especially if you yourself notice that you are having some sort of hearing loss, then you need to get that assessed right away. There's no point in you waiting until it gets to the worst situation and then letting your doctor know. This is something that you can prevent. There's many different types of hearing aids that will help. There's things that your doctor will recommend for you to do that will increase your acuity in terms of hearing. So these are things that you need to do, and you have to make sure that you advocate for your health. That's the most important thing. There are surgical procedures that doctors might recommend if you have ringing in the ear, if you have different types of conditions that affect. But the hearing loss is the most important. If you have, because that affects the quality of life, right? So if you're not able to communicate and you're not getting the full gist of someone's communication, that's a problem. That needs to be raised awareness right away in terms of that problem, so that you go and take care of it. If you're a senior, you have Medicare. Medicare covers certain amounts of hearing loss aids, and they cover certain procedures that they do that improve hearing loss. The other thing that's important is general inflammation in the body. The more you lower inflammation in the body, the better your organs will perform. So that's something that we see common today in society, because a lot of people are walking around with a lot of inflammation in the body. So if you decrease that, that'll improve all senses and functions and organs together. So that's something that you can do and talk to your doctor about. At our facilities, we offer anti-inflammatory diets, anti-inflammatory treatments, anti-inflammatory IV treatments. We have all that at Genesis Medical Center. You can always comment or reach us, and we can give you the protocols that we have, and that not only helps you with your hearing, but it also helps you with mental acuity, and we call it cognitive rejuvenation, because a lot of people have this hearing loss and they also have memory loss, and we have a program that addresses that. That's very important to take care of that, because you don't want to deteriorate in terms of your thinking faculties and your hearing faculties. It's important to keep that in mind. There's also many directories for hearing loss that you can. The best place is your primary care doctor. That's by far the best place you can call. And if you have hearing loss, and if not, then you can go online and check out the resources and the directories that are there in your local communities. There's a lot of help. There's a lot of facilities. There's a lot of companies that assess hearing, and you can do that, and then they'll take care of all the Medicare needs and the numbers and all that. So it's important to keep in mind, and it's important for you to advocate for your health, and especially when it comes to hearing loss, whether it's conductive hearing loss, which prevents it's from the sound doesn't get through your inner ear, or whether it's sensorineural, which means that, again, inner ear damage, nerve damage, any of those things that I mentioned. So try to prevent that from happening. But if it does happen, there are treatments. If you do have mild hearing loss, let your doctor know so that they can start working on remedies right away and treatment plans right away, rather than letting you deteriorate and get worse. If you have any further questions or concerns about this, please comment and ask us, and we'll get back to you as soon as possible. With that, I'd like to bid you farewell, and we'll see you next week on our program here at Islamic Shura Council of Southern California on health. Looking forward to seeing you next week. Have a great week. Bye-bye.